In a world brimming with complexity, few creatures embody harmony like the honeybee. With tireless precision, she dances from bloom to bloom, each motion guided by millennia upon millennia of instinct, each act in service to the whole. And then there are the beekeepers, watchful stewards of this ancient symbiosis. Part agri-scientist, part poet, they move along their hives with the efficiency of Moe, Larry, and Curly, tending to the bees' needs as best they can comprehend, and with the infrequency of a waterfall in the Sahara, sometimes running off, flapping and flailing like a penguin on a hot sidewalk. This is their journey.
Welcome to Bee Love Beekeeping, presented by Mann. Today we're going back to Romania for part 2 in our series about everything apitherapy with our guest, the world's leading authority on apitherapy, Dr. Stefan Stangaciu, MD. In part 1, we learned all about propolis, proper honey extraction for medical uses, selling honey as a health product, and a ton more. If you haven't heard it yet, it's just last week's episode. It's number 250. Today we're diving deep on how to use honey to treat burns. Then we'll shift gears and talk all about bee venom therapy, Lyme disease, cancer. It's all coming up. And if you haven't yet subscribed to the show, please hit that button now. We really appreciate it. Dr. Stefan, let's jump back to honey for just a minute. How should I use honey medicinally? And by the way, I recently had experience using it on a burn. Why don't you tell us about that and some other things to use it for?
Yes, very good. So honey for health. So first element, honey it has very small amount of water, and has this hygroscopic power. Like honey absorbs water, and absorbs also water in form of vapors. Like if you put honey open in a refrigerator, a jar open, it will absorb the aromas, the smells, the aromas from other foods. So, but basically honey absorbs water. And this is very good when you treat wounds, because in a wound you have dead cells, kind of dirty water, bacteria and so on. So this effect of honey, like absorbing, it creates a kind of vacuum, biochemical vacuum if you want. This is very useful. But here is the trick. And some beekeepers, they tell to the customers, take my honey before breakfast on an empty stomach, or take the pollen on an empty stomach in the morning. And this is a mistake, because when honey lands on the stomach mucosa, if that person didn't drink anything since last evening, the stomach mucosa will be more or less dehydrated, doesn't have enough water. So when honey or pollen comes there, it absorbs the water from the stomach mucosa, and the stomach mucosa will become irritated. So once it's irritated, it causes pain or discomfort in the stomach, and that patient may take the wrong conclusion that he or she is allergic to honey, or it's intolerant to honey or to pollen. And this is very bad, because once such an idea comes in the mind of a person, this person all its lifetime will say, oh, I'm allergic to honey, and then will tell to all the neighbors, honey can give allergies to stomach, look, I got stomach pains. So how to take the honey correctly? Before you take, in fact, any bee product, honey, pollen, propolis, bee bread, royal jelly, you need to drink some water. So you drink like in the morning before breakfast, but you drink first water, let's say a glass of water or half a glass of water. You wait 5-10 minutes for the stomach mucosa to absorb the water, and then you take the bee product, whatever it is, honey, pollen, propolis, royal jelly, whatever. You put first under the tongue, and you keep it there 2, 3, 4, 5 minutes. Why? Because under the tongue we have special venules and capillaries which are absorbing some of the small components from the bee products. They come into the bloodstream and goes much quicker to the areas where you have a problem, let's say kidneys or bones or joints. And then when you keep the bee product also under the tongue for several minutes, in the case of propolis, you can keep it even 1 hour. The volatile from these bee products, which are in the mouth, through breathing, these volatiles, they are absorbed passively into the lungs. Okay? So you are doing a much better, do the administration in the same time sublingually, through the lungs, but also when you swallow the product, it's like oral administration. Get 3 ways to administer the product if you keep it under the tongue. Yeah? Of course, here is another practical tip. When you take royal jelly, because royal jelly is very, very acidic, it's like lemon juice, even more acidic than lemon juice, I believe. So this will create a lot of saliva, being so acidic. So when you have a lot of saliva in the mouth, you cannot keep it normally, and then you have this tendency to swallow quickly. But the trick is to keep the chin a bit down like this. You took the royal jelly, you keep the chin like this. It will come a lot of saliva in this area, but we can resist longer in this position than like this. Yeah? Okay, so honey, like honeybee products to take like this practically. And then for the wounds, for the burns, by the way, I'm an old guy, I'm already 65 years old. And a couple of years ago, I went to an university. I said I would like to have a PhD study. And my topic for my PhD study now it's burns, bee products, medicinal plants against burns. So it's a fascinating topic. And I give to your audience, people know the best protocol against the burns, which is the conclusion of all my studies in the last years. So first thing to do when it comes to burn, immediately, you come with a running water at body temperature or room temperature, not cold water, not hot water, of course. Running water, room temperature. About 4 or 5 minutes. And why? Because water can absorb a lot of heat which was there in the skin, in these tissues. This is first step. Second step is to because here through the burn in the skin there are a lot of free radicals and also toxic substances are there. You need to come to block immediately the free radicals. And there are several options here. So one option is to use water propolis extract or to use honey. But if you want to take honey to take out the dead cells, a liquid honey will be good, like acacia honey or any kind of honey which is fresh, is good, is ecological, to take these dead cells. And the propolis is the fastest to block the free radicals. Once you block the free radicals, of course, first thing the patient will feel, like when come quickly with these 2 products, they will have not any more pain. Like the pain, the huge pain of the burn reduces very quickly in a couple of minutes if you apply these products. Now, a very, very important thing here is that when the patient, they go regularly to the hospital, in the hospitals, before they arrive to the hospital, they get this perfusion with glucose and so on, or water on the way to the hospital. And then in the hospital, unfortunately, my colleagues, they are making, I say it's a mistake. They use some liquids. They put some liquids on the skin, which are antibacterial or anti-inflammatory, but they are not so good as our honey. What is happening when you can destroy the bacteria? There's no problem, but you want also to block the free radicals, and these antibacterial agents are not blocking the free radicals, so good like honey and propolis, and also they are not helping the regeneration. So, and now it's another very, very important practical tip. Remember from the school, from the physics, that the burning, it's a process, it's a physical process, which is allowed by the presence of oxygen. So, if you keep the wound open, like in the hospitals, in the bed of the hospitals, the oxygen continues to come into the skin, and the burning process, it's a very, very low kind of burning process, continues. And then the patient next day has a deeper burn than it was when he arrived to the hospital. So the Chinese, I was lucky to see a group of Chinese doctors in Toronto in 1995. It was an international conference on apitherapy. And it were two Chinese doctors, and they said that they have a special ointment based on honey, propolis, and two other ingredients. And they were able to save the life of the patients even in 95% surface body burned. 95%. And they said that the healing is almost without scars. And their trick, I'm giving now the tip, is to put big amount of honey on top, not a small layer of honey, but big amount of honey, let's say half a kilo of honey around this burn area, and then to go around the honey with a thick layer of bandage. So, and these two things blocks the penetration of oxygen and stops the burning. Yeah? So it's so logical, so simple.
Plus, I would guess the bandage holds the honey in place, so it doesn't just run off, right? Okay.
Correct. And creates what is called a wet environment. In the last years, doctors from all over the world, they understood that healing of the wounds in a wet or humid environment goes much better than in a dry environment. Yeah? So, and then if you continue to explain how it works, honey and propolis on this area, so it's the first phase, which is to block the heat, then to block the oxidation. This is done sooner or later. But then the mistake in the hospitals is that they do not think to the nutrition of the cells which are under this burnt area. These cells which are under the burned area, they are blocked by an edema, a swelling, because the cells which are there under the wound, they do not want to allow bacteria, possible bacteria, to come into the body to cause an infection, a septicemia, and to kill the patient. So what are doing these cells which are under the wound here? They block the blood flow through this edema. But this creates a situation where nobody wins. The skin cannot be regenerated, the bacteria maybe are kept under control by this antibacterial, but the regeneration cannot happen because these cells which are underneath, they need vitamins, they need amino acids, they need fats, enzymes, and so on to just regenerate. And the beauty is in apitherapy that honey has almost all these kind of nutrients. It's true it's a very small amount, like 5%, but when you have honey topically on the wound, these 5% nutrients are enough to restart the regeneration. And honey comes also with this vacuum effect. So the healing, the regeneration with honey starts much faster. And usually by helping all these cells to regenerate, in most of the cases, the healing is beautiful, no scars or very small amount of scars are present.
Amazing. All right, if you don't mind, we're going to keep jumping here. Let's get over to bee venom. And this could be 10 hours too. But where do we start with bee venom?
Yes. With bee venom, we start first of all with the analysis of the beekeeper. Let's speak about beekeepers. There's a saying, it's much better to prevent than to treat. So in the case of bee venom, the worst scenario is, of course, anaphylactic shock. So here is my thinking. If somebody says, okay, Dr. Stangaciu, I would like to start beekeeping. So my first question to him is, do you have any allergies? Do you have any allergies on antibiotics, drugs, dust, whatever? If they say that they have an allergy, the risk to get a bee venom allergy is already 2-3 times higher than the rest of the population. If they say that they have 2 or more allergies, not only one, then the risk of having a bee venom allergy is like 10 times higher. Okay, so first question, do you have any allergies? If you have any allergies, then you need to go to the doctors, to naturopathic doctors, to specialists in allergology and so on, and to see what are the causes of this allergy tendency. because first step is to have a complete diagnostic of your own body. You need to have a list of weaknesses of your body. So if you have any weaknesses in the heart, in the lungs, in the kidneys, in the brain, whatever, you should not go into an apiary. Yeah. So if you have such weaknesses, you go first to the medical doctors, to naturopathic doctors, to osteopaths, whatever is needed to fix the problem, and then you come to the bees. Yeah. So this first step. When I have a patient coming to me and says, Dr. Stangaciu, I heard that these things are very good, very powerful against Lyme disease, for example. I say, yes, it's true. Lyme disease, melittin from bee venom, destroys very quickly this Borrelia. But we cannot do 100 these things tomorrow on your body because your body is not prepared to receive such a huge stress. It's very powerful, but it's stressful. So for the patients, what we need to do, we are preparing the body and the mind of the patient for about 4 to 6 weeks, which is, first step is having the diagnostic at all levels, physical, energetical, functional, psycho-emotional, even spiritual, complete diagnosis. The next step is to have the complete list of causes of the causes, not of the symptoms. Symptoms is very superficial. List of all the causes of the causes. And then when I have the list of, let's say 30, 40 such causes of the weaknesses, then I very carefully, very calmly, I see, okay, what of these causes I can neutralize. So this one I can improve, I can improve. What I cannot improve, I go to the specialist, to the therapist, yeah? So I need to eliminate all these causes which are causing me weaknesses. And then after this list of causes, I start usually with the first big therapeutical method is detox, fasting, detoxification of the body. This is all cultures, all religions, all civilizations, all doctors all over the world, in chronic disease especially, they speak about detox and they recommend the patients to do the detox.
It may seem early, but right now is a great time to order your live bees for 2026 because they do sell out and because Mann Lake is offering a discount for Bee Love podcast listeners. Wait, what? I know you're saying live bees, they never go on sale. Well, they are now. Click on over to Mann Lake, order your bees any variety, nukes or packages, and anything in the beginner essentials category. And when you check out, use the code Get Started in Bees. It's down in the show notes, so you don't have to remember, for a discount on everything. So get your orders in early and save.
Now the detox must be done not only at physical level, like laxative and so on, but also at energetical level. Because if somebody, for example, is intoxicated by a lot of mass media, a lot of TV, Instagram, Facebook, and so on, a lot of electricity around, even in the bedroom, it's a kind of energetical intoxication. And then you need to detox also the mind, because the Chinese are saying for thousands of years, the doctor specialists in homeopathy, they say for 200 years, most of the chronic diseases comes from psycho-emotional disorders or disbalances. When you have too much hate, you are too choleric, or you have depression, you have fear or worries and so on, this goes step by step from information mistake to biophysical problem, then to biochemical problem, and then it goes to in the matter of the body, like in the structure of the body. So complete diagnostic at all these levels. You have the causes of the causes, you do the detox, and after you do the detox a couple of days or a couple of weeks, depending on the situation, with the help of a good naturopathic doctor, you need to focus on improving the functioning of those organs in the body which respond quickly to the treatment. And these organs are the ones which are, in Chinese medicine, they are called cavitary organs, like the stomach, the small intestine, large intestine, urinary bladder, gallbladder. They are dynamic organs. So this is easier to correct with medicinal plants, with bee products. And then you focus, the next step is on the regeneration of the heavy organs, like liver, like kidneys, or like pancreas. Yeah. So this is the general strategy. And then you explain to the patient, look, we need to do all these things because we need to change your diet, your lifestyle. We need to improve these things. And then after, say, 1 to 3 weeks, you can use some bee venom, but in form of bee venom cream, not injections, not bee stings, because the body is not prepared and the mind neither. So, and then you start gradually. After 4 to 6 weeks, you make another analysis. And in many cases, by the way, in my experience, when I started with apitherapy, in the first years, I was jumping very quickly to bee stings therapy or bee venom injections. But later, during the year with experience, I saw that if the patient takes these measures, like cleansing, changing the diet, no more McDonald's, no more Coca-Cola, Pepsi-Cola, and so on, like improving the diet, improving the lifestyles, sleeping better, then they get already healing or they get much improvement without need of bee stings. So bee stings should be the last resort. If nothing works, I go to bee stings. Of course, first micro bee stings, and I need to do the allergy test. And normally the patient, like the beekeepers too, they need to go to an allergy specialist, and they need to do 2 tests. One is the blood test. They give the blood to analysis, and they need to check special antibodies, which are called immunoglobulin E, like E from Europe. Immunoglobulin E specific to bee venom. And then second step is like prick test, like direct test on the skin with the bee venom in solution. This is the best thing to do because you can know, are you really allergic or not? And then if these tests are okay, both of them, then I can go slowly with the dose from small dose to big dose. And I have a graphic here. In this graphic is about the dose, because everybody asked about the dose, what is the best dose of the bee product. And we have here several kind of bee products, which we can use in apitherapy. So first is the allergy test, and then you increase gradually the dose, and you look always to the evolution of the patient. How are the symptoms of the patient? When the symptoms of the patient starts to disappear, to go out, and the blood analysis and all the other analyses are improved, it means that you have reached the what I call healing dose. So this one is variable. It's not fixed. Like every person is different. So they maybe needed different kind of quantities depending on the person, and also a different kind of time. So some people, they react quickly, some need more time. But anyway, when the patient arrives to the symptom-free situation, then you stay on this dose until the specialist in the disease, if it's diabetes, it will be the diabetologist, if it's the heart, it's the cardiologist. The specialist should confirm, yes, the disease is healed or it's much improved. And then when the specialist confirms that the disease is improved or eliminated, then you can diminish the dose. But here is the beauty in apitherapy, because we do not go to zero, like in the case of use of chemical drugs, cortisone and so on. We can remain on a preventative dose, on a prevention dose. Because we use the bee products, we continue to use the bee products as foods. And here, from here to here, they are used mainly as what we call nutraceuticals, which means as nutrients and pharmaceutical products. But here is mainly as a food, but preventative food. Yeah. So this is the general schema for the doses, and this can be applied in almost all diseases, all situations. And the important part again is to correlate the dose with the reaction of the body, to listen to what the body says.
And give us just a quick rundown. You mentioned Lyme disease. What other kinds of things might we use that for?
Bee venom is very, very good because it stimulates very powerfully the nervous system. So whenever there are nervous system diseases, like Parkinson, Alzheimer, dementia, multiple sclerosis, or peripheral neurological diseases like lumbago, sciatica, and so on, these neuralgias, right, the correct application use of the bee venom can help a lot. The Russians, many years ago in the 50s, they already proved that bee venom, bee stings, increases the blood flow in the brain like 2 times more. Yeah, also the blood in the coronaries around the heart, also 2 times more. So if you have already the patient has a good diet, not more smoking, no alcohol, no drugs, no constipation, good kidneys, and so on, so on. So when the blood is clean, and then you give propolis, royal jelly, pollen, you make the blood not only clean but also rich in healing substances. This blood, which will come to the area where it's a disease, a problem, will help the healing much faster. So that's why you need to have always this integrative approach, like holistic approach. You need to treat the mind, the body, every single part. Myself, I have had 2 times discal hernia with here on the back with huge pains. Like second time, my colleague said, Stefan, come quickly to the hospital because you'll get paralyzed if you stay at home because we need to operate you. But I said, no, I'm a medical doctor. I'm a apitherapy practitioner. So I asked my wife to make injections with Bee Venom. And in 2 weeks, I was out of this discal hernia pains. So because Bee Venom, it's also antispastic. And here is one explanation. When the people have a discal hernia, of course, not very big, like the disc is not completely out. When it's just at the beginning going out, the muscles which are in that area, they get a kind of panic because they think that this may go too big and then the body will get a paralysis. So the muscles which are around, they get spastic. It's normal to be a bit spastic contracted for a while to maintain the structure, but when they become too spastic, they block the blood flow in that area, and blocking the blood flow or reducing the blood flow or lymphatic flow leads sooner or later to accumulation of toxins, residues, acids, because all the cells in that area, all the cells they liberate, they free outside all kind of toxins from normal metabolism of the cells. And when these toxins are not washed away, they cause acidity in the area, and the acidity are burning the nerve receptors, and then they get a lot of pain. When you come with Bee Venom, you relax the muscles. You relax the muscles. If you go to an acupuncturist, he will use a very big needle, goes into that muscle which is contracted, and this method relaxes the muscle. And once the muscle is relaxed, the blood flow is again okay, and then the pain goes away. So this happens in 95% of the cases. So Bee Venom, it's extraordinary for the pains. And I remember one of our colleagues in apitherapy from Spain, from Madrid, Pedro Perez Gomez. He worked 30 years and he was doing practically his main activity was back pains. All kind of back pains he was treating with Bee Venom therapy. Yeah. So, but there is another very, very interesting application of Bee Venom, because Bee Venom stimulates not only nervous system very powerfully, but also the cardiovascular system, because the heart must pump stronger to run away from an angry beehive, like Africanized bees, for example. So the blood flow is improved a lot. And here is the other big family of diseases where you can help with Bee Venom: arterial, vascular, venous diseases, like thromboangiitis obliterans, Buerger disease, all kind of arterial problems. You can treat with the right doses and the right protocol, of course. Yeah. And then another groups of indications for Bee Venom are the bacterial or viral diseases, because Bee Venom destroys the bacteria very quickly. This melittin, it's like a knife with two endings, and the melittin goes into the membrane of the cell, and it destroys that membrane, creates special pores. But it's interesting, the same melittin on our normal cells, it doesn't do so much damage. In case of cancer cell, it causes 24 holes in the medium, and then the cell will be destroyed. But on our human healthy cells, it creates only 4 such pores. Yeah. So cancer, it's another way of application. Of course, cancer is extremely complex disease, so you need to approach it from all points of view. You need the cooperation of the oncologists and so on, but it can be done. Yeah. So
speaking of cancer, I read about a study not long ago I believe it was in Australia, where they were doing some Bee Venom injections in breast cancer, and saw really great results from it. Do you know anything about that particular study?
Yes, yes, yes. It's a very famous study, and it circulates all over the internet. It's translated in many languages. It's a very, very good discovery. But that discovery, like many other discoveries on the bee product's properties, the experiment was done on cancer cells which were like in a petri dish, like in an isolated environment. And then the cancer cells were attacked directly by the melitine, by the bee venom. So when it's such an effect, those cells cannot defend themselves. So they are 100% destroyed. And this we see the same kind of result with propolis, with royal jelly, with honey, and so on and so on. But in the human body, it's completely other story. Unfortunately, in the human body, the immune system of the patient, if it's not improved, or the blood flow is not improved, cancer will come to other places, or it cannot be treated, because there are so many causes which support the cancer development. And these causes, if you do like very, very restrained, very small kind of treatment, you cannot block all these causes. So if I have a patient with breast cancer, I would go through all these methods I told you before, like complete diagnosis, because one of the major causes of the cancer is the lack of oxygen. It's called hypoxia. So when in a certain tissue in the body it's not enough oxygen, the cells are desperate for oxygen, so they'll turn their metabolism from aerobic, like based on oxygen, to anaerobic, based on carbohydrates, and then they go like crazy. So the first thing to do, if it's a patient with cancer, is to improve the overall immune system and overall blood flow and oxygenation. Because you can have a treatment good here, like surgery or radiotherapy, but then the patient will have 20 other tumors in the rest, in other organs in the body. So you need to think very, very deep. So you correct this oxygen element, you improve the blood flow, because these immune system cells, some of them are against the cancer, like killer lymphocytes. They need a lot of energy, they need water, they need antioxidants, they need vitamins, and you need to provide all these things. So you need to change the diet, to improve the diet, to come with all bee products, and you go from many, many different points of view. Of course, there are many other causes of cancer, like depression, melancholy, sadness, and so on, the emotional causes, so you need to address all these causes.
Thanks again to Dr. Stefan. We're wrapping up the year next week with the final episode in our apitherapy series, and you absolutely won't want to miss it. Until then, be sure to follow, subscribe, tell your friends about Bee Love Beekeeping presented by Mann Lake, and a quick shout out to Vita Bee Health for their support. Vita's Varroa control range of products includes Epistan, Epiguard, and now Viroxan extended release oxalic acid strips. Thanks, guys. Merry Christmas. Happy holidays. See you next week.